Fear and frustration are the common emotions expressed by those accessing and working in Tasmania's health sector. With $100 million to be cut from health this financial year, no one area is immune. Under immense pressure already are the community's most vulnerable, the mentally ill, their families and carers. As Fiona Breen found out, many are already finding it difficult to access services they need.
Putting together hundreds of wheelbarrows might not be everyone's dream job, but for schizophrenia sufferer Peter Byrne, it's perfect.
Putting wheelbarrows together keeps your mind off things, so you're not dwelling on all sorts of stuff. Like sitting in a chair at home, yeah, that's terrible.
He's part of the Start Fresh team, a Colony 47 social enterprise providing supported employment for people with mental illness. The program gives its employees flexibility and extra support with things like budgets and accessing housing.
I only do 2 days a week and I don't do any more than that. They don't ask me anymore to work anymore because I get stressed.
We have people who suffer from mild mental health disabilities up to schizophrenia, bipolar, and a lot of those things could be a result of trauma in their life, drug abuse, alcoholism, or just, bad luck, which is probably not a very good term.
A team of 30 people with mental health problems build wheelbarrows and flat-pack furniture. They clean offices, buildings and houses around Hobart. Some have been unemployed for a long time. For others, like Jean Kemp, it's a whole new experience.
No, I've never worked.
I think what they get out of it is they get the sense of self-worth. They have a reason to get out of bed, they have a reason to come to work, they mingle and meet people who have similar conditions to theirs.
One small positive for a struggling sector. Solidarity forever. But the celebrations for such successes during Mental Health Week have been overshadowed by the state government's announcement of budget cuts.
But what we are doing is working around what our new models of care. I'm sorry, you've invited me to speak and I'm happy to speak.
At a mental health expo in Hobart, there was talk of fear and uncertainty.
Well, it is of some concern because there's still so much uncertainty, and we've had a 5-year reform process which may or may not come undone, and that's what we're yet to find out.
We've been advised that the CPI increase on our funding, which is calculated on an annual basis, will only be 2.1%. I know from having done my budget for 2011-2012 that the real cost increase for this financial year is about 8% for the organisation. The organisation has a shortfall of about 6% to find in our budget. That has a real impact on our capacity to go to the remote areas in particular, such as the far side of the east and west coasts.
Despite deep concern amongst mental health sufferers and their carers, most aren't willing to go public.
It often can cause extra issues for the person that they're caring for because it can add to their stress if they feel that that's being talked about. The stigma that's attached to mental health is also a significant issue. I mean, it's very easy for people to talk to somebody who has a broken arm or a cold, but to talk to somebody about mental health issues and the impact that that's having on their lives we've got a long way to go before we are comfortable having that as an ordinary conversation like we would a broken arm.
Many, however, are contacting service providers, frantic at the news of more cuts to the mental health sector.
Their families are saying, it's already in crisis. We have stories of people telling us people are lined up in an accident emergency waiting for a bed who are acutely unwell and they're waiting overnight, they can't get into a bed.
Some can't even get a case manager.
There's some bubbling away and people are fearful of what all of these cuts might mean. People are concerned that the people in that service system are getting stretched and stressed, so the staff that are employed by the state government, the staff that are employed by community sector organisations are really working very hard, and there are long waiting lists, or we call them assessment lists.
In one area of Hobart, the waiting list is at crisis point.
We know that there's up to 200 people waiting for a case manager, for example, so who's actually then going to be able to provide those services?
Families and carers are worried life is just going to get harder.
So are they concerned that it's going to be left to them more and more?
Absolutely, and that's what they are experiencing.
Mental Health Week this week, Poverty Week next. The two issues often go hand in hand. Research shows people with mental health illnesses are vulnerable to a cycle of poverty. Colony 47's Kevin Todashini sees it all the time.
Two of my employees who were living in a vehicle, and as a result of having a job here was able to get out of that and receive a Housing Tasmania property, and I see that as a positive thing as well, because that particular person has just made this journey work for them, and that's what we're about.
Before Start Fresh, Peter Byrne lived tough.
I never believed I was in poverty. I lived in a chook pen for a while. That was the smallest and coldest place I ever used to sleep.
He now feels more positive about the future.
The money helps because we get paid a fair bit. For supported employment, we get paid a lot. We get nearly award wages. I guess we do.
Having a job has certainly helped Peter Byrne's mental health.
It's a good feeling to have a job and be paying a bit of tax for a change. And when people ask me, what do I do? I can say, I put wheelbarrows together at K&D. What do you do? So, yeah, that's a big plus, because people treat you differently once you've got a job and you're contributing to the community.